The topic is Minority AIDS Outreach, and we're talking to Miss Beverly Brown, who is the Education and Medical Consultant for the Minority AIDS Outreach Program. And let me welcome you to Black Pulse, Ms. Brown. We mentioned in our introduction, Ms. Brown, that AIDS is a very, very important disease, and of course it has a special impact upon minority groups in this country. And we'd like to start off by talking about AIDS. First, if you would give us a definition of what AIDS is and the impact that this disease has on the minority population.
When we talk about AIDS, we are talking about the human immunodeficiency virus that causes the disease. However, there are certain stages that the disease actually goes through. A person could actually be diagnosed as being what we call HIV positive. The person could have what we call the ARC, the AIDS-related complex, before they actually get into what we call a full-blown case of AIDS. The bottom line as it relates to AIDS means that the person's immune system is not able to fight off a disease once they actually have acquired this particular disease called AIDS. As I say, it is a killer. At this point, we don't actually have a cure, but that's when we talk about AIDS, that's what we talk about when we're talking about AIDS, a person's inability to fight off a disease once they've actually come in contact with the virus.
Now, how do you contract this disease?
There are several routes of transmission as far as the disease AIDS right now is being transferred. The one that we most commonly hear of now is certainly with intravenous drug use, with the transfer of persons using needles, certainly with sexual intercourse, and not whether it's in the bisexual group, the homosexual group, or the heterosexual groups of persons. When we say the heterosexual population, a lot of times people say, well, that's not me because I don't entertain some of the homosexual type activities, or I'm not bisexual. However, you certainly could still have contact with a person that was a known IV drug user and still certainly end up acquiring the disease. So a lot of times when you have contact with somebody that has been exposed to the virus, you may not always know all you need to know about that person's history. We also know about the possibility of it being transferred through blood transfusion. That's many times when people go into surgery. Right now, the probability of that happening is very, very slim, and even prior to putting some of the mechanisms to prevent the disease from being spread, there are mechanisms in place to evaluate any blood before a person actually receives it. So the probability of that happening either from a person donating or receiving blood is very, very slim to null at this particular time. So we don't actually consider that as a main route of transmission. The other is certainly with a mother to her baby when it's born. And many times, even though the person may not be of the homosexual group of persons, it still means she's having contact possibly with somebody that maybe have had drugs. So of course at the time when the baby is born, it's passed at the placenta or at the birth canal at the time when the baby is delivered. So it means it puts the baby as well as the mother at risk, and that more times than not is why in the minority population that our area is very high, because more times it's not necessarily all of the bisexual activity, which there is that in the minority community, but as well as
homosexual activity.
Homosexual as well bisexual activities. That's a route of transmission of the disease. It means drug usage is how many times with some of the minority groups, whether it's blacks, Asians, Latinos, that is how it's being spread many times in those particular groups.
And so you say the major area in terms of trying to stop the transmission of this disease has to do with the IV drug users, even though we admit that there are these other areas in which persons... Well, now, the organization that you are a member of, that you are a consultant with, Minority AIDS Outreach, could you perhaps tell us something about this organization, how it came into being, and some of the programs that you have to deal with that particular problem that you're talking about?
At this particular time, some of the things that we've done, Minority AIDS Outreach came into play as a result of an educational program that was offered on the Meharry Hubbard campus last May of 1987. As a result of persons like Matthew Nelson, as well as Joyce Perkins, who were persons on that program, they presented a challenge, and Janet Pierce at that particular time, who's the head of the Nashville Cares, was saying there was very little minority or black involvement, particularly in the groups that were already actively participating in trying to educate the minority community, and it was our focus to try to hit a population of persons that had not been actually tacked at that particular time. Some of the other things that we've done as a part of that outreach to try to reach the minority community is even back in December of last year of '87, we went out and actually canvassed the North Nashville community area where we actually shared information, and we also, in many of the businesses in the North Nashville region, allowed us to leave information, and since that time we've gone back and added additional information. The other things we've done is just recently, as 2 weeks ago, is with the canvassing of the Cell Courts project area and sharing information related to education, because one of the things we found is that even though we offered a program back in February, we had good attendance, approximately 75 persons from the community come and attend that outreach program. A lot of times you don't always have persons coming to you, so you have to go to them. So that's one of the ways that we have found to do that, is to go to the community and share those educational programs. We have certainly been to places like TSU and to some of their health educational classes. We've been to the Bowling Green campus downtown. We've been to Fisk University and some of their health educational, as our way of going to the community when they don't come to us. A lot of times to find out, to know that we actually exist. We've been to places like even IRS doing some of their educational programs for their staff or training. The other areas, even AT&T, in trying to reach the community in whatever way that we possibly can, because right now the group consists of a variety of professionals from all walks of life, from persons that are directly in the community that have some direct contact, as well as other health educators as myself. And I am a registered nurse, and several of the other persons are registered nurses or persons that actually have direct counseling or contact with clients, whether it's through some of the other health systems that are in the community. And we share that information in trying to ward off some of the deadly effects that AIDS can have if we're able to get an environment where we're allowed to share that information. We've been to several of the churches in the communities that have allowed us to come in. And it's just our way of continuing the process of reaching out to the community.
Very well. Ms. Brown, what would you do? I mean, what could you ask the community to do in terms of making the Minority AIDS Outreach Program that you are connected with a much more influential organization? In about a minute, give us that information.
The way I would say right now is certainly we are a volunteer group. Anybody that's interested in sharing that information, because sometimes you're able to penetrate populations that we would not be. So even calling our number, which would be 327-2340, to get additional information about how can you become an active part of volunteering for our group.
Very good. Thank you very much. And we'll be back with you following this commercial break.